Greetings, well-beings. I'm Dr. Sherazad, and I'm back reacting to a hilarious show that I found on TV. It's called St. Denis Medical. Let's get into it.
To be a doctor. And then when I was in college, my nan got sick, so we spent a lot of time in the hospital. And that's when I realized that the nurses really provide the care part of healthcare.
Okay, she's not wrong. Let's be honest. Nurses provide a lot more empathy and compassion than doctors do. I think it's because they are bedside 24/7, literally right outside the patient's room in the hospital. So they kind of hear and see all the nuances of the family visiting and the patient's actually sleeping or awake or whatever. So they can relate to the patient as a human more. So she's not wrong.
So I became an RN, and I love it. You know, it's not always glamorous, and our patients don't always appreciate us.
Oh my
And the
God.
pay's not great.
The patient just flipped the tray. It's not always glamorous. I remember the first time I heard thank you in the hospital was during COVID in 2020, and I've been practicing as a hospitalist since 2014. I mean, patients dealing with serious illness are often consumed by their medical situation and logistics with their family and friends and whatever they've got going on. The relational aspects have changed across the board, especially with the new politics and healthcare bills that have been passed. What do you think? What's something else you've been observing with patients and healthcare professionals?
I mean, considering the amount of work and the risks that we take, every now and then a moment comes along.
Okay, he just tried to light a cigarette around the patients, but hospitals have oxygen supply systems throughout, and oxygen is highly flammable. So a lit cigarette near an oxygen equipment can cause fire or explosions. So funny, but definitely very unsafe.
We are a safety net hospital, which means we provide care to everyone. But that just means we have to work extra hard and stay positive.
So basically, safety net hospitals are facilities that provide healthcare to low income or uninsured patients. They're often public hospitals that are in rural or urban areas. And on July 1st in 2025, the Big Beautiful Bill Act was passed, which cuts a lot of money from healthcare, $1.1 trillion, which means, unfortunately, that people will not only lose their health insurance because it's going to become more expensive. And so it'll be interesting to see how it affects the whole healthcare system.
Hey, you guys, what is it that I always say? What's the most infectious thing in a hospital?
C. diff?
Antibiotic-resistant staph.
No.
So she's talking about hospital-acquired infections. So hospital-acquired infections are called HAI, and they're important because 1 in every 31 patients in a hospital can be afflicted with the HAI. In terms of bacteria that cause infection, it's Staph aureus or MRSA, which is methicillin-resistant Staph aureus, C. diff, E. coli, Enterococcus or VRE, vancomycin-resistant Enterococcus, Pseudomonas or Klebsiella. Those are all the bacteria that can cause hospital-acquired infections. So staying in the hospital longer than you need to is never a good idea. I remember having awkward interactions with patients or their families when they would not want to leave the hospital. And I think there's a social sense of, well, there's more people around, more support. Let's keep going.
Most infectious thing in a hospital is a smile.
Never heard you say that before.
You always work past your shift.
Not tonight.
How about a backup milkshake? You seem like a hazelnut gal.
He's trying to tease her and egg her on because I think he can tell that she's probably going to stay later than she should. She's also the same nurse who bought treats from the vending machine for the patient that was being discharged. So there seems to be a trend here. So he's trying to tell her,
Okay, can you go help a sick person now?
I hear you.
You know something? I need a
Pause. My leg hurts. Does not get seen before my spleen exploded.
Well, my spleen hurts too.
Where is your spleen?
Like right in this area. I mean, what? And
she's kind
sometimes
of
it
pointing
comes
to
in
her
creeps over
breast
here.
area. But anyways, right under the breast
Have
is
a
the
seat.
liver,
Next in
gallbladder.
line.
New today?
Next in line.
I'm not injured or anything.
Good. Then you have no problem walking to the back of that long line of people who are following the rules.
Oh my gosh.
Next in line.
That's hilarious.
How can I help you today?
Late on my first day, not ideal.
He works there
I was
and
born
he's
in a really
standing in
religious
line like
community
a
that
hospital
doesn't believe
patient.
in medicine, so when I told my parents I wanted to be a nurse, my dad was not happy, He was like, why can't you be more like your cousin Wyatt,
There's a lot of religious groups that aren't into conventional medicine. I think some of the most common ones are Christian Scientists, Jehovah's Witness. I know that Jehovah's Witness in the hospital, they do not want blood transfusions, and respect to each culture, tradition, religion, and priority beliefs. At the same time, in order to get a blood transfusion, you have to sign a consent form. And in order to refuse blood transfusion when it's indicated, you have to sign a refusal, I know I'm refusing kind of thing.
Well, I just examined a patient with heart murmur. Now I'm going to spend 40 minutes filling out electronic health records.
What would I do for a murmur in the ER? I would do an EKG and echo troponins and do a cardiac workup, but definitely basic bread and butter CBC, CMP, EKG, echo, troponins, maybe cardiology consult if I'm worried that the murmur is causing the symptoms.
You're gonna twist that line. You know what? I'm just gonna do it. I'll just do it. Hi. I mean, this is not the type of job, where if you mess up, it's like, oh gosh, we lost a big account. You mess
Definitely a
up, it's,
control freak.
we took out the wrong organ. You don't have to do things my way, but you do have to do them the right way, which is, how I do them.
Hilarious. I just love that they like look at the camera like you're watching this, right? Like I'm watching this, we're here to this together. It's so funny. It reminds me of The Office. Being a control freak and OCD in the hospital setting is actually kind of a good thing because it's protective, life-saving, especially in hospital settings where there's so many miscommunications. So having those kind of tendencies is actually a really good thing. Oh my gosh, he's doing CPR on the keyboard. So it looks like the system went down and the surgeon's being a surgeon. And how did he think of that so quickly?
I'm kidding.
She's like not laughing at all.
Oh, sorry. I'm Matthew. I'm the new schmuck floor nurse. Oh boy.
Oh my gosh, he's so funny. His scrubs are so big. He's obnoxious. He called himself a schmuck. That guy called him, the surgeon called him a schmuck. It's like a Yiddish American slang word for a fool. It's not as harsh as like a bad insult, but it's teasing him for sure.
But now that I'm a hospital administrator, I'm battling different kinds of cancers.
So a lot of hospital administrators used to be clinically based practitioners, and it's true. Like doctors and nurses tend to go against like administration as if like they are different than them. So it's an interesting dichotomy that exists.
Tell him there's a nursing shortage and we need him to fix the healthcare system.
Oh
Next.
my goodness. So basically there is a healthcare shortage of nurses. There's about 200,000 nursing positions unified across the country that are empty.
I never knew I was allergic to avocados.
Yeah, they're silent killers.
Avocados can be silent killers, yes. Let's talk about adult onset allergies. So there's something called the latex fruit syndrome, and about 30 to 50% of people with allergies to latex can also develop allergies to the proteins in avocados and several other fruits and nuts. And it's an allergy that develops later in life.
You want me to? Not a problem, because I am a nurse. So, okay. It's just a quick stab. Oh, sorry. All right, 3, 2, 1, stick. Okay. Wrong side. Got myself. Oh, that's intense, huh?
You okay?
Oh my God. You know, it's like a bad sign when the patient's asking the nurse if they're okay. Epinephrine is a powerful vasoconstrictor. It gets your heart racing, gets your blood pressure up. It is a chemical resuscitation drug that we use for patients who are comatose, who have shock, who have no blood pressure on their own.
I mean, you want me to bail the second that my shift is over? I'm sorry that I care.
I think you're a workaholic control freak, and you're afraid that if you do go and nothing bad happens, that just means you're not as important as you think you are.
Let's just talk about boundaries in healthcare. Like people need to know when to let go. And I honestly see myself in this woman sometimes, like she goes above and beyond. It's just that there's a professionalism. And I watched this clip with Dr. Mike interviewing this awesome psychiatrist who said there is something called the wall. I think it's called the wall, where doctors really shouldn't break that wall, like give patients a hug. But I also find that it's very healing when doctors do that. So it really is dependent on the situation and what's going on. Patients like breaking down and crying about their life stories with me. I'm not going to sit there like cold like a wall. I'm going to like approach them, offer them a little like hand on the shoulder and just support them.
I mean, I love this job, but it is just a job, you know? Ma'am, are you okay? If you're having trouble, you really shouldn't leave.
Terrific.
I love the writers of this show because they're really testing her boundaries to see like how far she's willing to go or not go with going to her kid's performance. So they like place the perfect situation.
Ma'am, are you sure you're okay? Oh, God.
Oh my gosh. And of course, she's the only person who witnessed her syncopizing or passing out. Hey, we got some medical stuff.
Matt, use the intercom!
Is there a button I'm supposed to push or something? I've never used one of these before.
Oh my gosh.
Code blue, I repeat, code blue.
This is so true actually because like hospital intercoms all work differently, and so if you don't know the phone system or paging system, you don't actually know what to do. So nobody heard anything.
I need a doctor urgently. Cavalry's on the way, guys. Fell and
What's
is
happening?
old,
Left in the
elderly.
parking lot, shallow breathing, hypoxic, 83%. We lost her pulse.
Oh, wow. She sounds super smart right there. And she went hands off because she let the doctors take over so they can do the assessment.
She said her leg hurt.
Sounds like DVT turned pulmonary. Let's get some heparin in here.
That's a valid differential, that DVT from leg pain that led to a pulmonary embolus, which needs blood thinners like heparin.
Pneumothorax.
It's an embolism, Bruce.
I think it's both.
Oh my God. So the surgeon's like, I think she's a smoker. I hear wheezing and maybe it's a pneumothorax. And they're totally different differential diagnoses. Less likely that he's right, but look at the conviction in his face.
All right, let's get her stabilized. We'll do a CT scan.
Prep a tube. Give me M&A's too.
Calling for M&A.
I'll get the
PA
bag.
ready here.
Ron is Professor X.
That's it for today's reaction video. Be sure to watch this pit reaction video everyone loved.